Hi everyone, it's William with the Grand Duke Dmitri 1939 series. I'm coming at you today, as you no doubt recognize from Dmitri's room, and I'm stationary because unfortunately I've managed to misplace my selfie stick. I think I mentioned before that I wanted to do a video out front going from the funicular station to the entry to the sanatorium, now hotel. But yeah, we kind of, well, the gardeners kind of made an interesting discovery the other day. They found a very carefully constructed and old tunnel going under a slope. We haven't figured out yet how far it goes. Very, as I say, carefully and laboriously constructed, and then the entrance was covered up. It's not that big. It's maybe a quite a small person could crawl through it, but it clearly wasn't made for a person to traverse. But yeah, I was making a video, and we were in the garden, and then we were in some other places, and so hopefully it will turn up. I really don't want to buy a new one, but anyway, we'll see. So apologies for that. This is part 8. We are very near the end now of this long letter, unfortunately, because it's such an interesting one. It's one of the most interesting things that I've come across of the things that Dmitri wrote, both in and outside of his diary. And he's in such an unusual state of mind. And there are only a few occasions in the diaries and in the other things he wrote when he was so, on the one hand, so emotional, and on the other hand, so willing to reveal his feelings. I mean, he often does in the diaries, but not really in this state of mind where. Yeah, I mean, he was a kind of a depressive individual, and he will be again. So it's rare for him to be so absolutely happy with what he sees as the trajectory of his life at that particular time. So for a recap, the nurse, we talked about her. I don't have a name for her, but for me at least, her reputation preceded her. I'd heard about her before she popped up in Dmitri's diaries and in this letter. He is also in a poetic state of mind, and he talked, for instance, about the fear that comes by night. And then he had this really sort of almost transcendental experience where he went out on the balcony and he just felt kind of overwhelmed by the beauty of everything, and he came back in his room and fell on his knees and gave thanks to, as he said, the one whom I call God, for the way everything had gone in his favor during a very difficult and frightening few days. Okay, so he also gave us a bit of a timeline. So we found out that he'd been really very actively ill, having night sweats and that sort of thing for about 3 months. So, approximately June 1939. Okay, our cast today is, again, the nurse and also the head doctor, Dr. Maurer. I hate saying head doctor because it sounds like you're talking about a psychiatrist, a head doctor, or a neurologist. But at any rate, the German word is difficult to pronounce. It's Chefarzt, I think. So sometimes I use that word. Okay, so let's get going. From that Sunday, 3rd September, until now, a period of exactly 3 weeks, I've been lying on my back, and apparently will continue to lie for a long time. I get up only to take a bath in the morning, shave, and use the toilet. Here's how I'm feeling now. I no longer cough and clear my throat only rarely. I've stopped spitting, even in the morning, after 10 years of having done so, and bringing up horrible pus. Here they measure how much you spit, and for the first 4 days, I was bringing up the maximum. I eat almost every 3 hours, and for the first time in my life, I'm hungry for breakfast. Really hungry, exclamation point. On the third day, my temperature was normal all day long, and so it continues. The pain in my chest is gone, and since I almost never cough, the pain in my bronchi has also gone away. The senior doctor said, I have rarely, very rarely had the opportunity to observe a patient such as you. You have the constitution of a horse and an absolutely phenomenal heart. I must pull through. I wish to pull through. Amen. Mysticism? And here we have 2 exclamation points and a question mark. And the doctor himself knows it, but officially speaks only about that horse-like constitution and extraordinary heart. As for the nurse with the mustache, for some reason she speaks to me in English. She said, what a strange person you are. You could have been months here and not have done such progress. I must pull through. So that quote of the nurse is in English, which is why it's not the way a native speaker would phrase it. You have been months here and you could have been months here and not have done such progress. So a native speaker, of course, would say, and not have made such progress. All right, that's just incidental. So I should say that the diary, this letter is what I'm really relying on for understanding what Dmitri's initial experience was at Schatzalp, because he was not writing his diary while he was on bed rest. And it may have been, it seems like he was in a mood to write, but it may have been that he wasn't allowed to. They made an exception, maybe, to let him write this, to let him write this letter. But a lot of times in the first month or longer, depending on how sick a person was, when they initially checked in, I think I mentioned it before, they were put on total bed rest. And in strict sanatoriums, that meant that you weren't even getting up to use the bathroom. You were using bedpans. You weren't allowed to sit up initially. If your temperature started to show improvement, then you would be at first allowed to sit up for like 15 minutes a day. And you would have had a bed bath, and you would have, in the strictest sanatoriums, you would not have even been allowed to read when you first got there for the first, several weeks. You wouldn't even be allowed to read, because part of the rest cure was mental. You were supposed to sort of completely shut down. And I've read in other books how patients were able to cope with that. At first, they found it, of course, very, very difficult. But then they would just get into this kind of almost trance-like state where they just didn't care anymore. They didn't want the stimulation. So, I don't know with Dmitri. He tells us he was able to get up to go to the bathroom and to take a bath in the morning. But I think he was not allowed to keep his diary. I'm sure he was allowed to listen to the radio. And I would think he was probably allowed to read. I mean, Schatzalp was a real sanatorium, but it was catering to an elite clientele, and they weren't going to push things to the extent that somebody would leave. Okay, so he's really happy about this progress that he's making, not surprisingly. He tells us that he was spitting for 10 years, but actually I misspoke the other day when I said the doctors had estimated that he'd had TB for 10 years. They hadn't. And so the spitting, I would guess, was just because he was a chain smoker. I mean, that makes sense, right? The fact that he was coughing, the fact that he was spitting every morning, bringing stuff up, that's typical. That's typical for someone who smoked as much and as long as he did. Those of you who watched the 1907 video series or the 1906 video series know that, he refers to stealing cigarettes from the Tsar when he was 14 years old. And so he was smoking for a long time. And he was chain smoking. You rarely see a photograph of him where you can see a casual photograph, not a posed photograph, where you can see his whole body that he isn't carrying, that he doesn't have a cigarette. So anyway, that is not at all surprising. He's attributing it to the TB. Well, maybe he's not, but he's saying now I'm not doing it anymore. So this 3 weeks of bed rest has been actually a big success. Now the pus that he refers to, gross, I know, but he's not pulling his punches. That came from a secondary infection. And he'll talk about that later. He'll talk about that he was actually diagnosed with gangrene in one of his lungs. And they had to treat that quite aggressively, and we'll hear more about that treatment. And, so you wouldn't have been bringing up pus from a tuberculous cavity. That would have come from a not infrequent secondary infection, a sort of opportunistic infection. And he talks about how the spit was measured, the sputum, as they called it, was measured every day in these little containers. And they also would culture it once in a while. They would try to culture it. And one of the reasons why TB could be so easily misdiagnosed is that they couldn't always culture it. It wouldn't always grow. And so then they were left to wonder, was this a correct diagnosis of TB? But Dmitri was definitely cultured positive. I think he talks about that at some point. So the spit was important. And in fact, if you weren't spitting, in some cases, people weren't spitting at all. Especially, of course, if they had TB, not a cavern or something like that. Well, then they would do something that was very, very unpleasant, and Dmitri was quite lucky that he didn't have to have it, and that was gastric lavage, where they would try to go in and get it from the saliva that you had swallowed that was already in your digestive tract. So, I've read that was one of the most unpleasant procedures that you could have, so he was lucky that he was spared that. He didn't have a problem producing sputum that could be cultured. Okay, let's see. I've talked before about the fear that spit on the ground would could spread the infection, which was not true. Although I would guess it's probably responsible for a lot of municipal ordinances about spitting on the ground. It seems to be that something, nowadays most people are civilized enough not to do that, but it seems like in the past people did do it. And, there was this fear of tuberculosis, and that was probably why you have, municipal ordinances against it, would be my guess. I'm not speaking as an authority on that. But there was also a fear that people would spread the infection within their own body. And I don't know. I don't know enough to know if that actually happened or not. It certainly was considered, to be good medical science, that you could end up giving yourself tuberculosis of the digestive system or tuberculosis of the throat, which was a very common side effect if you were not getting rid of that spit, if you weren't spitting. Okay, what that is when your spit was culture positive. Once it ceased to be culture positive, then after originally having been so, then it wasn't as big a deal. And that was when they would typically, in public sanatoriums, they would give you, once you were culture negative, they would give you permission to go and have home visits and things like that because you weren't considered contagious anymore. Okay. So this mention that he makes about never having been hungry for breakfast in the past and now wanting it. Well, I'm not sure if that really came from illness, because, a lot of people, myself included, wake up not really wanting breakfast, and maybe you have it a few hours later. You're supposed to have breakfast. Yeah, it's supposed to be the most important meal of the day. But I know a lot of people, myself, like I say, myself included, who it takes a while for the appetite to kick in. And Dmitri does not talk about having breakfast in his diaries. He talks every day about having lunch and dinner, but I think for breakfast he just had coffee. Okay, what else? So Dr. Maurer is telling him all of these wonderful things. And is he laying it on thick, or is it in fact true? So, as Dmitri would realize later, Dr. Maurer would lie about especially about what your prognosis was. But on the other hand, I don't, maybe he was exaggerating a little bit, saying, "Oh, you have a phenomenal, exceptional horse." The constitution of a horse and just a phenomenal heart. Maybe he was exaggerating, he probably was, but I don't buy the whole idea that Dmitri was always sickly. I think the people around him who loved him always worried about that because of the fact that he'd nearly died at birth and that he'd been a 7-month baby. But I don't get the impression that he was sickly at all. He had psychosomatic issues. Like when he had his shell shock after the invasion of East Prussia, and he had this mysterious feeling of weakness and couldn't do anything. And also when he first was banished from Russia after the Rasputin assassination, and everybody was afraid that he was so ill. But once he realized that life wasn't horrible, within a week of getting to settle down in Persia, he was fine. All those symptoms went away. So I think he was, by and large, a strong person and a healthy person. He had had typhoid, for instance, and had survived that. He hadn't had trouble with the Spanish flu. He was a tough guy, and I think he did have a good constitution despite being a premature baby. And I think a lot of people would have just died who were in the state that he was in with that secondary infection. So I think the doctor and the nurses were genuinely surprised at how he seemed to get better so quickly. And of course, it's not that easy. This change of lifestyle, all the rest, and the eating, they caused this improvement, but it wouldn't last. So, unfortunately. But anyway, as always, when he's writing in an emotional state, he uses more English, and he particularly uses English whenever he writes about pulling through. That's his expression. Apparently, he couldn't find one in Russian or in French that quite expressed it as well as that did. So again, he's talking about mysticism, even writing the word amen, amin. And and what is most interesting in this, to me, we already know that he's having this experience, but what's most interesting about it to me is that he's saying that both the doctor and the nurse notice that there's something going on here behind his, in addition to, and even more importantly than his strong constitution. What a strange person you are, says the nurse. So what does that mean? Oh, you're a weirdo? No, certainly not. But he's interpreting it as he told Maurer about it. He probably told the nurse too. He told them what his beliefs were, what his mystical beliefs were. And Maurer actually brought that up later when he was depressed and said, well, what about this, what about this optimism that you have based on internal mystical kind of beliefs? So he told them about it, and he's saying, oh yeah, they noticed this, he maybe hadn't told them about it yet, but and it was so rare for him to confide in people like that you can say that he really was in a strange state of mind when he did that, whether he's done it yet or not. And he thinks there's something about him, some kind of aura about him that they can see. So anything else? Yeah, so, and he's underlined when he says the doctor himself knows it. He's underlined that sentence to emphasize how important it is to him that the doctor has figured this out. And that the doctor talks about his physical advantages, his strong constitution, because that's officially what a doctor should say, but that the doctor realizes that there's something else going on. He's surprised that the nurse speaks English. Schatzalp, like many of the sanatoriums in Davos, were really, really international. I think the most of different nationalities that I've found on the guest list at Schatzalp were something like 29 or 30. And that, of course, was before the First World War, when you didn't have countries, that were made up of smaller countries like Yugoslavia or Czechoslovakia, but still, the mixture of nationalities was just amazing. These really were international institutions. And so, of course, the staff had to be able to read different languages, to speak different languages. And maybe the reason they assigned the mustache nurse to Dmitri was because she did speak English. So anyway, anything else? Well, just what do we have next time? So more details about the illness. We get more details about the way that the illness was manifesting and had manifested with him. And we get more exchanges with Maurer, and we find out something about the treatment plan, the individual treatment plan that they've designed for him. So, I'm so glad he was in this mood, and he wrote in such detail about all this. Anyway, I hope I find my selfie stick soon, and so I hope you'll see more videos in motion. But in the meantime, thanks for watching, and I'll see you next time. Bye.